Hey guys, in today's video I'm going to talk all about microblading your eyebrows. You all have asked me to cover this topic and it kind of piggybacks off of my Q&A on Friday about thinning eyebrows and the medical reasons behind thinning eyebrows. So if you're coping with thinning eyebrows or eyebrow loss, definitely check out that video. But what is microblading? Microblading is a form of permanent makeup or cosmetics that is a variation on a tattoo. Microblading differs from a traditional tattoo in that a traditional tattoo actually uses a handheld machine to deposit pigment into that deeper layer, whereas with microblading, they're actually using a single-use sterile handheld tool to deposit that pigment into the deeper layers of your skin in a stroke-like fashion. And because of this, because of the way that the pigment is deposited in the skin, that subtle difference, this is why microblading fades much more quickly than a tattoo. Because as they are stroking the pigment through your skin and into the dermis, there's bleeding that occurs and you get pigment loss. The pigment is extruded out through the skin at the same time as the blood is coming out of your skin. But microblading is actually a great option for people who are coping with what's called eyebrow hypotrichosis, or thinning, loss of the eyebrows, due to a variety of reasons, many of which I covered in my Q&A on thinning eyebrows. This is a type of tattoo, so in terms of complications, the same complications that can happen with getting a tattoo can occur with microblading. One complication is that people can actually develop an allergy to that pigment that is deposited in the deeper layer of the skin. You might already have an allergy to some of the components of that, or you may develop one with time, causing you to have problems with the tattoo. And simply the fact that it's going to fade faster doesn't mean that it'll go away per se. You'll still have that allergen in your body, and that can cause problems for you, definitely. So that is certainly a risk. If you are somebody who scars very easily, you make those thick scars, or you make keloids, I would say stay away from those. Anything that creates injury in the skin, whether it be a tattoo, microblading, you want to avoid. The last thing you want is keloids on your eyebrow area. Keloids can develop in people who are predisposed to very minor trauma to the skin. Ear piercing is really common. Children get their ear pierced, develop a huge keloid on their earlobes. So if that's you and you know that in your history, stay away from microblading. Also, if you have certain skin diseases, you definitely should stay away from tattooing and microblading. Some skin diseases exhibit what's called Kebnerization, meaning anytime there's any trauma or stroking of the skin, the rash will come out. A disease that classically does this is psoriasis. If you have psoriasis, I would not do microblading because it can make your psoriasis come out in your eyebrows. If you have a history of Herpes Simplex virus breakouts on your face, I would avoid microblading. Well, I would talk to your healthcare provider before doing it. The reason for this is that any procedure on the skin of the face and people who are predisposed to herpes breakouts can elicit a breakout. And that's not a great thing because when you break out in a herpes virus rash, you shed some of that those virus particles, and they can then get into the area that's been treated that is essentially wounded skin in a sense. So whether that be from the tattoo or if you had a resurfacing laser, for example, and that can cause a really bad, more widespread herpes viral kind of infection on your skin. So you don't want that complication. If you have that history, definitely talk to your healthcare provider before doing something like microblading or any kind of procedure on the skin of your face, because an antiviral medicine may be prescribed that can reduce that risk for you. But I would definitely say, be cautious if you have that history. And obviously if you have any active skin infection or you just don't heal well, say for example you are on a medication that lowers your immune system, you may want to reconsider doing this because you could potentially develop scarring or some sort of issue as a complication, more so than someone who's not on one of those medications. I think one of the scarier things though, and not uncommon unfortunately, that can definitely happen with microblading is going to be skin infections due to the technique of the individual not using sterile technique or what have you. So it's one of those things where you really have to spend a lot of time reading reviews, talking to your friends who do this, and finding reputable people in your area. In terms of how this is regulated, it varies a lot from state to state. In the state of Texas, in order to do microblading, that's actually under the auspices of the Texas Health and Human Services Department. And basically, in order to do microblading, you have to pay a $1,000 fee to the Health and Human Services Department for your facility. And that involves a regulation of the facility, so how hygienic the facility is. And you also have to be 18 years of age or older, and that's it. You don't have to go to cosmetology school. You don't have to have any sort, there's no regulation as far as the skill set of the individual. That can vary a lot, which is kind of scary. Basically, I mean, you can go on YouTube and see videos teaching people about microblading techniques. So somebody could be totally self-taught and be doing this. So you kind of have to be careful with who you select as far as their technique and their skill set. There's no regulation, for example, on the pigments that they use or select for you, or their technique, how they do it. So they could have shoddy technique. There's no oversight into that. So that's something to be aware of. That's how it's done in Texas. Other states are going to differ as far as how those things are regulated, but it varies a lot. For Texas, it's similar to a tattoo parlor. The other thing is, I think they're prohibited from tattooing, from doing microblading on a minor. I don't know if they can do it with parental consent. I'm not sure. Comment below on if you do microblading in Texas, if you're an artist or if you get it done, like if you know more about this than me. But my research and my knowledge base, I know that you don't necessarily have to have a cosmetology license to do microblading. Once you have the microblading done though, in order to protect it and to preserve it and make it last longer, something you definitely want to do is to cover the eyebrows with a Vaseline petroleum jelly before doing, if you use vitamin C serum, if you use any kind of topical exfoliant like salicylic acid, benzoyl peroxide, alpha hydroxy acids, anything like that. If you use tretinoin, adapalene, or tazarotene, or retinol, any of those that exfoliate the skin, you want to definitely coat your brow area with Vaseline before you apply those, even if you are applying that stuff to other areas of your face, because it can migrate and travel around and get on your eyebrows and fade them, and do so in more of a patchy fashion, which you definitely don't want. So cover your brow area with Vaseline. Other things that will accelerate the fading of your microblading include ultraviolet radiation from the sun, so make sure you're putting sunscreen on your brow area, or obviously wearing a broad brim hat also helps protect them to a certain extent as well. But also LED light treatments will fade the brows as well, and so will, if you get a facial, whether or not they be using any kind of exfoliant or not, steam from the facial can accelerate the rate of fading of your brow. So I would avoid that kind of stuff. I mean, personally, I don't recommend people do facial steaming. It can cause flares of acne and a lot of other problems for the skin. And now if you've invested in having your eyebrows microbladed, it'll fade those. So yet another reason not to steam your face. If you do have eyebrow microblading done, and you're gonna have later on a laser procedure, whether it be hair removal or treating hyperpigmentation, I mean, you name it. If you're having laser treatment of any kind or LED light treatment of any kind to your face, what you want to do is cover your brows with a thick, non-nano-sized zinc oxide sunscreen. Like one of the baby sunscreens that you put on, it's like white paste. I'll list some down below, but you basically want to put that on the brow area to protect your microblading. Now, microblading is permanent. Even though it fades, it is actually permanently part of you in a sense. What if you get microblading and you hate the way it looks and you want to get rid of it? How do you get rid of it? Well, that's where the dermatologist comes in, and that is going to be laser tattoo removal, essentially. I can tell you firsthand that laser removal of a tattoo, it almost never looks I mean, it almost never, if at all ever, goes back to looking like your skin did before you had the tattoo. There's always some hint, residua of a tattoo there. So it never really looks right when you do treatment of a tattoo with a laser to get rid of it. And it requires different lasers, and you know, there are great laser surgeons out there who do really phenomenal work in removing tattoos, but it's really expensive and really painful, not something fun to go through. You would think with microblading that it'd be easier to remove because it fades faster, and it's actually the opposite. Microblading is a lot harder to remove than regular tattoo because of the way in which the pigment is deposited in the skin. It's dragged through versus just direct deposit. So that makes it harder in terms of directing the laser to remove that pigment, that pigment and whatnot. Also, the inks, the pigments that they use, they require certain lasers to remove. Traditional Q switch lasers shouldn't be used on these because, first of all, they can cause a paradoxical darkening of the pigment, and they also can singe the brow area. It's really challenging. And so definitely something to think about. If you don't think that it's something you're gonna want as a part of you long term, indefinitely, don't get it. Same with a tattoo. If you're thinking about getting a tattoo, really think about it. Especially, not to pass any judgment, but especially if you are in your 18-year-old time period, early 20s, give it a few years, you know, make sure you really want that as part of your body. That being said, tattooing, this is a side note, but tattooing really has a lot of cultural meaning attached to it. So it's definitely something that means a lot to people, and I'm not blowing that off whatsoever. But make sure it's gonna mean something to you for the rest of your life, because taking the steps to get rid of it, not fun. That's everything I can tell you about microblading, you guys. Comment below on if you've done it and what your experience was with it. I always love hearing that from you all. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.